Sensation. Sensation refers to input of outside physical world through our sensory receptors. This is the first step of receiving information. So we have basically five senses: hearing, voice, taste, smell, and touch. In addition, our skin contain warmth, cold, pain sensations, and our muscle, tendon, and joint give us position and tension in the muscles. These senses are known as kinesthesias. The process of sensation, physical energy, which leads to transduction at the receptors, generator of reception potential, then generation of action potential in the nerve, then impulse generation and pattern of nerve activity in the nervous system, and then finally sensation. Attention. Attention refers to person's ability to attend to a specific stimulus without being distracted by extraneous internal and external stimulus. Perception. Perception occurs when stimulus has undergone a processing according to its form, color, motion, and meaning. Perception involves top-down and bottom-up processing of sensory information. Bottom-up processing consists of primary process that transforms sensation into perception of the object that have form, color, motion, and location in space. And top-down model involve influences of our learned experiences about the object to narrow the competition between the possible interpretation and the sensory information. Perception is not a passive receipt of these sensory signals, but can be shaped by learning, memory, and expectations. Imagery. Imagery is internal mental representation of the world and is actively drawn from memory. These are residual sensory percepts. Imagery underlines our capacity to for many crucial cognitive activities such as mental arithmetic, map reading, visualizing and imagining places previously visited, and recollecting spoken speech. Now, the difference between a perception and imagery. Perception is concrete reality. However, imagery is figurative and have a character of subjectivity. Perceptions occur in external objective space, whereas imagery, they occur in internal subjective space. Perceptions are sensory element. In perception, the sensory elements are full and fresh. In imagery, the sensory elements, although full and fresh, are relatively insufficient. Perceptions are clearly delineated. Imagery are incomplete and poorly delineated. Perception are retained unaltered and constant. Imagery, they have to be recreated always. Perceptions are independent of our will, and imagery depends on our will. Then is eidetic imagery. This is a vivid memory image that occurs immediately after any type of perception. It can be evoked through simple visual inspection of physical objects or stimulus. The prominent feature of this imagery are people continue to see a representation of the visual stimulus sometime after it has been removed. They are seeing a true visual image and not merely the memory of the stimulus. This is more common in children than in adults. This is also called as photographic memory. Then obsessive imagery. These are recurrent, intrusive, repetitive, and thus distressing to the individual. The persistence before mind's eye of something seen usually recently. Example, a 47-year-old wife kept seeing car license plate that had come to her attention. A patient saw her baby being flushed away in toilet whenever she entered the bath. Abnormal perceptions. Abnormal perceptions are of two types: sensory distortions and sensory deceptions. Sensory distortions are further divided into sensory changes in quality, changes in intensity, and changes in spatial forms. Changes in quality can be hyperesthesia or hypoesthesia. Changes in intensity can be xanthopsia, chloropsia, and erythropsia. And changes in spatial form can be macropsia, micropsia. Then sensory deceptions can be illusions, hallucinations, and pseudo-hallucinations. Illusions are of three types: complete illusion, affect illusions, and pareidolia illusions. Then hallucinations are auditory hallucination, visual hallucination, tactile hallucination, smell and gustatory hallucinations. Functional and reflex hallucinations are two different kind of hallucinations: extracampine hallucination, autoscopy. First is sensory distortion. This is a constant real perceptual object which is perceived in a distorted way. It means the object is perceived correctly, recognized and identified, yet there is deviation from its customary appearance without compromising with the knowledge of kind of thing it is. Sensory distortion occur in the form of change in intensity, quality, spatial form, and splitting of perception. First is change in intensity. Hyperesthesia. Hyperesthesia is due to lowering of physiological threshold. There is increased intensity of sensation. In visual hyperesthesia, the normal colors may be reported as excessive bright. Example, during epileptic aura, during hypomania, and with LSD drug abuse. Auditory hallucination, hyperacusis. Daily household talk may appear excessively loud. Example, in anxiety, in hangover from alcohol, and in migraine. Hypoesthesia. Hypoesthesia is due to rise in physiological threshold. There is decrease in intensity of sensations. Visual hypoesthesia is reduced intensity of color perception that occurs in depression and in schizophrenia. And in auditory hypoesthesia, hypoacusis, there is occurs in delirium, depression, and schizophrenia. Gustatory hypoesthesias, also refers to as hypogeusias. They are present in the form of complaints that all the food tastes the same. Then are three terms: palinopsia, palinociosis, and palineptia. Palinopsia is prolongation of a visual phenomenon beyond the customary limits of appearance of the real event in the world. Example, a cat noticed in the street one day kept appearing at various times and various situations over next few days. When the similar thing occurs in auditory modality, this is palinociosis, that is persistence of sound that is heard beyond customary limits. Example, a patient returned to answer the door several times during 30-minute period after the doorbell had actually rung. Then when the similar experience occur in tactile modality, this is palineptia. Object held in the hand continue to be perceived even after it has been discarded. This palineptia can also be seen in sensory agnosis. Then there is dyschromatopsia and achromatopsia. Dyschromatopsia is perversion of color perception, and this occur after unilateral posterior lesions. And achromatopsia is complete absence of colors, and this is seen in unilateral or bilateral occipital lesion, usually in the lingual and fusiform gyri. Then there is changes in quality. Changes in quality, visual. These are visual distortion brought about by toxic substances which color all perception. Example, the drug sildenafil can cause blue vision. So coloring of yellow is xanthopsia. Coloring of green is chloropsia, and coloring of red is erythropsia. Changes in spatial form, changes in size, shape, and distance of object from the perceiver. There can be macropsia. The size of the perception can be larger. Micropsia, the size of perception is smaller. Hemimicropsia, apparent reduction in one hemifield of vision. These three phenomena can also occur in retinal disorders, in accommodative disorders, and also in parietal lobe lesions. Then there is metamorphosia, alteration in customary shape of the perceived object. Paraproposia, when metamorphosia affect faces, this is paraproposia. Then telopsia, it involves the object appearing far away. Alloesthesia. Alloesthesia is a neurologic condition seen after right side vascular lesion of putamen. It is characterized by a sensory stimulus of one side of the body being perceived on the contralateral side. Similarly, there is akinetopsia. This is impairment in visual perception of motion. It is a very rare phenomenon and said to follow bilateral cortical damages. A lady had a difficulty in pouring coffee into a cup because the fluid appeared to be frozen. Also, she could not stop pouring at the right time since she was unable to perceive the movement in the cup. Then there is splitting of perception. It occurs in organic state and also in schizophrenia. In this, the patient is unable to form a usual assumed link between the two perceptions, which are associated normally. For example, a patient watching television experiences a feeling of competition between visual and auditory perceptions. Her feeling is that both of them are not coming from the same source, but were competing for her attention and conveying opposite messages. Sensory deceptions. In sensory deception, first is illusion. Illusion, Askerel described illusion as transformation of perceptions coming about by mixing of the reproduced perception of subject's fantasy with natural perceptions. Basically, these are stimuli from perceived object are when the stimuli from the perceived object are combined with mental images to produce false perception. This is illusion. There are three types of illusion: complete illusion, affect illusion, and pareidolia illusion. Complete illusion, for example, one of the patient I saw said ki when she woke up one day, she saw image of a goddess in cloud. This complete illusion. This depend on inattention for their occurrence. For example, we commonly miss the misprints in the newspaper because we read the word as if they are written correctly. As soon as our attention is drawn to mistake, our perception alters. This demonstrates the perception of closure in Gestalt psychology, which says there is human tendency to complete a familiar but a not quite finished pattern. And a complete illusion depend on inattention. In contrary to pareidolia illusion, which increase by our attention, often happen to individual without making an effort and may continue against their will. Example, vivid pattern of face and people and animal can be seen in fire and clouds. Then third is affect illusion. This illusion basically depend on the prevailing mood state of the person. A child who is frightened of dark wakes up in half night and mistake a towel hanging by the wall for a person moving. Then the difference between fantastic illusion, intellectual misinterpretation, and perceptual misinterpretation. Fantastic illusion, the patient sees extraordinary modification of his or her environment. Example, the patient looked in the mirror and instead of seeing his own head, saw that of a pig. Then intellectual misinterpretations. Here the object is perceived in exactly the same way, but wrong interpretation has been put on it. Example, when someone says doctor is not really a doctor, but a public prosecutor. Then there is perceptual misinterpretation. It involves making a mistake as to the nature of perception without that perception being influenced by emotions and fantasy. Hallucinations. There are different definitions given for hallucination. According to Askerel, it is a perception without an object. Horowitz in 1975 viewed hallucination with a cognitive approach. Hallucinations are mental, according to him, hallucinations are mental images that occur in the form of images, are derived from internal source of information, are appraised incorrectly as if from external source of information, and usually occur intrusively. Jasper in 1997 said that hallucinations are proper or false perception that are not in any way distortions of real perception, but spring up on their own as something quite new and occur simultaneously with and alongside real perceptions. First is auditory hallucinations. This is the occasional vocalization of our own thoughts. Hallucinatory voices were described as phonemes or by Wernicke. First is elementary auditory hallucinations. For example, a patient saying कि हर वक्त कानों में चुप चुप की आवाज आती है, and sometimes people say कि हवा की साए साए आवाज आती है. These are form of voices. These are unstructured sound. It occur in the form of voices of bangs, whistle, sound of machinery. Often it is very unpleasant and frightening. It occur in organic states and in schizophrenia. Then complex hallucination. It is characterized by sustained voices clearly heard, originated in objective space. The voices may be single, multiple, male or female, or both, and people known by the patient or not known. The voices are clear, objective, definite, and normal percept, which at the same time may be incomprehensible. Running commentary. In this, the voices talk about the person in a third person, could be discussing the patient among them, or may even giving a running commentary on the action of the patient, or may argue among themselves about the patient's day-to-day activities. This is also one of the Schneider's first rank symptoms in schizophrenia. एग्जाम्पल अभी जैसे अभी भुवनेश खाना खा रहा है, दाहिने हाथ से अभी इंग्लिश की लिटरेचर पढ़ रहा है. These are running commentaries. Then are imperative hallucinations. These are voices giving instruction to the patient, also called as commanding voices. The command range from harmless acts like wash dishes, take bath, or to commit minor social transgressions like shout loudly, swear in public, to perform injurious action to others like kill or rape someone. Musical hallucination. These are experienced as tune, lyrics, and musical instrument, and these are usually found in old women with acquired deafness. Similarly, there is something called as Charles Bonnet syndrome, in which a visually impaired person sees visual hallucinations. Then there is thought echo or thought sonorization. Thought echo is the experience of the patient hearing his own thought repeatedly aloud by some outside source as if an echo. Thought echo is characteristic in schizophrenia. Then there is a talkie-talkie tongue. In this special kind, the patient hallucinates speech movement and hears speech which comes from their own throat but has no connection with their thinking. Next are visual hallucinations. Visual hallucinations are characteristic of organic state rather to functional psychosis. People with visual hallucination observe people, shapes, color, objects that are not actually present. Visual hallucinations are less prominent in schizophrenia compared with auditory hallucinations, and mostly it is visual pseudo hallucinations along with auditory hallucinations. These are seen in conditions like delirium in some organic state, occipital lobe tumors of visual cortex, such as due to tubercular granuloma, loss of color vision, homonymous hemianopia, dyslexia, alexia, cortical blindness, post-concussionnal state, temporal lobe epilepsy. And various dementias such as senile dementia, Alzheimer's disease, multi-infarct dementia, Pick's disease, Huntington's chorea. And it can also occur in eye pathology, but rarely in psychosis. First is elementary visual hallucination. Again, they are unformed. These consist of flashes of light, blotches of color, geometric shapes, or some other ill-defined images. These occur in organic and non-psychiatric processes. Then complex visual hallucination consists of well-defined object, people, animal or human-like figure, or religious figures. These occur in psychiatric illness and it occurs in clear consciousness and in temporal lobe epilepsy. Then are Lilliputian hallucinations. These are patient experience seeing people, object appear reduced in size or dwarfed. Seen in alcoholics, organicity, toxic psychosis, delirium, person with Lewy body dementia, seizure disorder, and in schizophrenia. Then there are scenic hallucinations or panoramic hallucination. These are interesting kind of hallucination in which the whole scene are hallucinated like a cinema. It is most commonly associated with temporal lobe epilepsy and with delirium. Hypnotically induced scenic hallucinations are known as lucid dreams. Then experiential hallucination. This was first described by a neurosurgeon, Wilder Penfield, who elicited them while stimulating various parts of cerebral cortex, particularly stimulating the temporal lobe. Then are static hallucination. It refers to visual hallucination which consists solely of stationary objects or patterns. Then hallucination associated with bereavement. An experiencer may see lost or loved person in his or her characteristic situation, which include him sitting in a couch or working in a garden, etc. Then are deathbed hallucination. These are visual hallucination occurring shortly before dying, sometimes described by dying person as an unusual light or energy or some scenes associated with afterwards. Then are peduncular hallucinations. These are cartoon-like visual hallucinations without depth. They are typically colorful, non-threatening images of animal and people. Peduncular hallucinations are found in vascular and white matter lesions in the rostral brainstem and its projection site in the basal ganglia, pulvinar, posterior, and medial thalamic nuclei. Alcoholic hallucinosis. They are commonly found in withdrawal state of alcohol associated with long-standing alcohol use in heavy drinking, typically 12 to 24 hours after stoppage of drinking. Auditory and visual hallucinations are most common in this. Then are Brobdingnian hallucinations. These are hallucinations of gigantic objects or creatures, and they are associated with delirium and dementia. These are exactly opposite of Lilliputian hallucinations. Then are somatic and tactile hallucination. Tactile hallucination appear to be phenomenologically different from other hallucinations because they are always associated with delusional component. Classification of tactile hallucination are superficial tactile hallucination, kinesthetic hallucinations, and visceral hallucinations. Superficial hallucination. This type involves the skin and are further classified into thermic, haptic, hygric, and paresthesias. Thermic hallucination. These are associated with abnormal perception of heat and cold. Example, patient experiences that his feet is burning in fire. Haptic hallucination, this is associated with sensation of touch. Here the patient experienced touch or pain. Example, patient experienced knife stabbing him. Then are hygric hallucinations, used to denote hallucination of water or other food perceived in tactile modality. Example, a patient saying पानी अक्सर मेरे सर से पेट के अंदर जाता है. Then are paresthesias, a tingling sensation of pins and needle. These may be hallucinations and they sometimes can be seen in peripheral nerve compressions or disease. Then is formication. Formication is a form of haptic hallucination. In this condition, patient has a feeling of animal crawling over the body. It can be found in acute organic state. If it occurs with cocaine abuse, these are called as cocaine bugs, or Magnum sign or Magnum slurry sign. When they occur in context of amphetamine use, they are called as crank bugs. Then there is delusional zoopathy. In this, there is delusional belief plus hallucination. Delusional belief that the animal are crawling about in the body. Then delusional zoopathy, it can be of two types: external delusional zoopathy and internal delusional zoopathy. In external delusional zoopathy, the patient experiences that there are animals crawling on the surface of body, although he does not visualizes the animal, but can usually describe in detail about its various characteristics. In internal delusional zoopathy, a patient believes that there is animal inside the body. That means he has a feeling of this animal crawling inside the body. The patient had somatic sensation which she knew were the result of wasp wandering inside her body. And then there is a Ekbom syndrome. These are formicative hallucination plus delusional parapsychosis. This may be accompanied by visual hallucination of insect, which may be regarded by the affected individual as confirmation of the actual bug infestation. Phantom limb. This is the most common organic somatic hallucination. Patient feels that they have a limb from which they are not receiving any sensation, either because it is amputated or because sensory pathways are destroyed. It occurs in 95% of all the hallucinations that occur after the age of 6 years. Then second kind of tactile hallucinations are visceral hallucination. In this, the patient complain of twisting and tearing pain in internal organs. Example, a patient describes sensation in the brain as layers of tissue being ripped off so as to bring completion between God and evil. Then there are kinesthetic hallucinations or vestibular hallucination. These are perception of movement of limbs and muscle being squeezed or sense of vibration in absence of said stimulus. It occurs in alcoholic intoxication and in benzodiazepine withdrawal. Example, a patient recovering from delirium tremens complained of feeling as if floating in air 50 feet above the ground. Then there is synesthetic hallucination or co-anesthetic hallucination. These are also known as hallucination in hallucinations of autosomatic awareness. These are used to denote a somatic hallucination consisting of peculiar visceral or other bodily sensation that cannot be explained by reference to any other physiological phenomenon. Example, a scratching feeling against inside one's skull, feeling like something burning in brain, urine passing through uterus. Then Charles Bonnet syndrome, phantom limb image, in which patient with visual loss has complex visual hallucination without significant psychopathology or disturbance in normal consciousness. Hallucinations are only visual, they do not occur in any other sensory modalities. Gustatory and olfactory hallucination. These hallucinations are unpleasant, foul or metallic taste, occur odor of rotting flesh, feces, burning rubber, or glowing sweetness. Gustatory hallucination occur in temporal lobe epilepsies, in migraine headaches, manic depressive illness, psychotic disorders, schizophrenia, and acute organic state. Olfactory hallucinations occur in schizophrenia, temporal lobe epilepsy, and in delirium. There is a phenomenon called as Padre Pio phenomenon, in which the religious people can smell rose around scents. Phantosomia and phantogeusia. Phantosomia is a vague odor without a scent being present. It can begin following sniffing or sneezing and is associated with damage to peripheral neurons that inhibit or stimulate olfaction. And phantogeusia is sudden vague taste without the presence of the substance normally causing the sensation. Then there are some different hallucinations like otoscopy. In otoscopy, the patient experience of seeing oneself in external space and recognizing that it is only oneself. The person sees his double in the external space. Then there is negative, this is mostly seen in parietal lobe dysfunction. There is no negative otoscopy when the patient looks in the mirror and he does not see any image of his own. And then there is internal otoscopy in which the subject feels his own internal organs. Subject sees his own internal organs. Then extracampine hallucination, that are hallucinations. Your example, when a patient hear people talking from another country thousands of kilometers away from him. These are hallucinations experienced outside the limit of sensory field, outside the visual field, or beyond the range of audibility. Then functional hallucination and reflex hallucination. These are hallucinations that require presence of another real sensation. When the stimulus and the hallucination occur in one sensory modality, it is functional hallucination. Example, a patient hears hallucinatory voices only when hears water running through pipes. This is hallucinatory voices and the sensation both in the auditory modality. Then there are reflex hallucination. Here the stimulus in one sensory modality and the hallucinations in other modality. Example, a woman experiences pain whenever certain words are being mentioned. This is reflex hallucination. Then there are hypnagogic and hypnopompic hallucination. Hypnagogic perception occur while going to sleep and pompic perception while awakening from sleep. These are normal phenomena. Then there is sense of perception. Most normal people have from time to time the sense that someone is present in that place when they are alone. For example, many people when in dark street experience that there is someone behind them. This experience is probably because of lack of sleep, hunger, and religious enthusiasm. The hallucination of presence can occur in organic state, schizophrenia, and in hysteria. And last is pseudo-hallucination. Pseudo-hallucination term was given by Hagen. Pseudo-hallucinations are vivid images with far more sensory content than normal images and ideas. Here in 1973 is given an example of pseudo-hallucination that voices heard by an obsessional person. It is described by the patient as voices, but are recognized as his own thoughts. Difference between hallucinations, pseudo-hallucinations, and imagery. Pseudo hallucinations share some characteristics common with hallucinations and some characteristic common with imagery. So hallucinations occur in outer objective space, while pseudo hallucinations and imagery, both of them occur in inner subjective space. Then pseudo hallucination have definite outline. Pseudo hallucination and imagery do not have a definite outline. Hallucination are full, fresh, and bright. So hallucinations and pseudo hallucination both are full, fresh, and bright, while imagery, most elements are dim or neutral. Hallucination and pseudo hallucinations are constant, while imagery is evanescent. It has to be recreated again and again. Then hallucination and pseudo hallucination both cannot be changed at our will, while imagery depend on our will. Insight is absent in hallucination, while it is present in pseudo hallucinations and imagery. Now, behavioral relevance. Hallucination and pseudo hallucination both are relevant to emotions, need, and action. Imagery is not related to emotions. Then hallucination could experience object in another modality, while in pseudo hallucination and imagery we could not experience this object in another modality. In hallucinations and pseudo hallucination, both are independent of observer, while imagery depend on observer for existence. These are my references.
Is anybody online? We are not putting this online. Okay. You can ask if somebody has questions.
So
can you please go back to the Jasper's criteria slide? Okay.
So which slide?
Jasper's criteria. Yes. Because the book, it is all clouded. It is more important. Not
so Jasper's criteria for hallucination.
Yes. This slide Jasper criteria are often asked. So the this is a separate here. You take it from SIMS, no?
Yes, sir. There are 5 to 7 criteria which compare them from normal perception.
These are criteria that are asked, Jasper's criteria, and get a short note on that. Not mentioned there, but we need to. Last slide now. Allocation to the illustration. So outer objective space and inner subjective space. Can you tell me the difference between the objective space and subjective space?
Subjective space is means what patient is thinking or inside patient's mind, and objective space is what he can see outside, what he can visualize outside.
Subjective spaces
is in patient's mind or what's inside his mind, and objective space is what he can visualize outside.
तो डिफरेंस क्या होगा जी मैं आपको बताऊं पेशेंट क्या बोल रहा है जैसे मन में महसूस होता है ना ये आवाज मन से आती है या बाहर से सुनाई देती है सो अगर किसी को बोलोगे कि लाइक फॉर एग्जांपल एनीवन ऑफ यू टू आस्क यू टू इमेजिन कि हमारा वार्ड पिक्चर इमेजिन करो तो यू विल हैव अ सब्जेक्टिव सेंसेशन एंड इफ यू फोकस इंटेंसली या आपने खाना खा रहे हो उसकी आप इमेजिन करो तो यू विल फील दैट सेंसेशन दैट इज सब्जेक्टिव ओके और तुम स्क्रीन को देखो सी इट ओके जैसे उसने बताया दैट इट हैज टू बी बिल्ट एवरी टाइम राइट आई आस्क यू टू वॉच द स्क्रीन सेट अगेन इफ आई आस्क यू to create that image, you will have to restart again. ऐसा नहीं हो सकता कि जैसे बोलो कि स्क्रीन को देखो अब वापस अपने वर्ड के बारे में सोचो अब वापस स्क्रीन को देखो वापस तो आप तो हर बार इमेजरी you will have to that you have to recreate it. Okay, so it takes time. Hallucination is like it just comes suddenly. You don't have to. Okay, ये imagery में है and imagery and real sensation can't coexist. Like if I ask you to imagine about something food that you ate in the morning, you imagine, and I ask you to at the same time concentrate on the body. You will have difficulty. Okay, so जैसे बताया इन्होंने इमेजरी में that both can't coexist, imagery and the real thing together. Hallucination में हो सकता है उसको ये बोर्ड भी दिखाई दे रहा है उसको hallucination उसको दिखता है. In terms, what are your thoughts? What did you learn from this? Different definitions, okay? किसके थे? क्या था सेमिनार? किसी के बारे में? Better or perception? Perception क्या हुआ? पहले बताया sensation, और फिर बताया बताओ तुमको क्या समझ आया? Perception. Perception basically तो ये जो है सेंसेशन से अलग सेंसेशन ही परसेप्शन एड ऑन सेंस में जैसे हमारे प्राइमरी ऑर्गन जो सेंस देते हैं ना वो सेंस हो टच साउंड राइट दैट इज सेंसेशन देन द ब्रेन एनालाइजेस इट एंड that subjective feeling that is perception. Okay? Perception is an English word. Most of the medicos they are unable to understand because they hitch it to the meaning of perception, literal meaning of perception. It is not that. You can't say it is processed information or processed sensation. That is. So that is perception. तो हमारे sensory organ जो हमको filter करके दे रहे हैं, वो उसको add on जो information है, that is perception. It usually coincides with the outside chair. I am seeing this chair, all of you are seeing this chair. So this is both through sensation, filtration, most of it is common mechanism. So it is same. अगर नहीं होगा तो फिर मेरा number of defects जो बताया उसने sensory perception, okay, these are all different kind of things. ठीक है? क्या है different sensation? कौन सा है? Okay. Very good. और इन सब में डिफेक्ट हो सकता है. ओके सब में हो सकता है. सब में डिफेक्ट हो गया तो उससे एसोसिएटेड कंफ्यूजन है. ठीक है. ओके. सबसे कॉमन क्या होते हैं? कितना टाइम हो गया साइकिल? कितने दिन हो गए? 4 days. कितने दिनों में कौन कौन टाइप के हेलुसिनेशन सुनने आए पेशेंट से? ऑडिटरी सबसे कॉमन कौन सा? साइकियाट्री में सबसे कॉमन है. बाकी जो है व्हाट डिड यू लर्न फ्रॉम द सेमिनार? इट इज वन पॉइंट समथिंग दैट यू लर्न टुडे. हम लोग कितना इसको पता है बहुत डिटेल में क्या आप लोगों को that hallucination does not always mean psychosis. Okay, so you see there are very different type of hallucinations. Okay, gustatory, auditory, visual. Okay, then again there are different types of mechanism of that. So it does not always coincide with psychosis. Sometimes तो अगर कोई भी इंफॉर्मेशन जो नहीं है बात की हुई है उसको हम even जैसे tinnitus अगर कोई अगर nerve issue है तो technically we can call it a hallucination because कोई source है उसको आवाज आ रही है paresthesia okay then this is difference in perception okay so perceptual abnormalities are not always equal to psychiatric problems. They can occur in neurological organic conditions okay so hyperalgesia hypostasia these can occur in neuron deficit so that is also okay. Having your questions. Have you seen any of these hallucinations in your patients recently? Can you remember any one of the types of hallucinations? Auditory hallucinations about moment or going? Maybe the patient that he was able to brush it also. Or a patient, huh? What is that? Zoopathy. Delusional zoopathy. Okay. So, उसमें क्या है most common cause zoopathy. Alcohol alcohol सकता है मतलब ऑर्गेनिक ओके और चीज है कि दैट पीछे जाओ उसमें था ना थोड़ा क्या कम्युनिकेशन ही tactile hallucination में these are all like usually with some एक वो अंदर कोई आदमी आ रहा है अच्छी गिरा ठीक है तो इसको वो नहीं होता है communication tactile hallucination पे जाओ phenomenological different from other hallucination in the way that there is a delusional component present in it. Okay. Tactile hallucination found normally most commonly in organic, but there is a bugs problem. It can be not just perception. Our cognition also fills in the blanks. We remember the context of the other things. So bugs are chronic. The person is feeling that something is chronic. Other people are also either build some beliefs in accordance to that. So there is a delusional, you can say, along with there some delusions coming. Tactile के साथ साथ है वो कोई बीमारी है आपको दिखाई दे रहा है वो convincing other people. Okay, so that is where you will see tactile hallucination. Auditory hallucination सबसे common है हमारे पास, but people do not go out convincing other people कि आवाजें आ रही है ऐसा लोग की बात नहीं मानते हो. But for some reason tactile hallucinations they are this component where maybe because it is can say I don't know. ठीक है. Any questions from any of you? Any add-on? हाँ. Flowchart also. Something like that. Things. Novel transformation. There is one more and short notes. So that is what you do the style. This one I would repeat everything to some extent. I told you often found real consciousness. Real consciousness
thing is usually when we withdraw it, but it is found if real formation without taking out, but it preserves itself. You've taken this one? That you mentioned about
You've taken this from shrimps or fish?
you mentioned reflex substances, right? So any this is the pathological. Fine. So anything which is a normal outer part of this, what is it called? If just to having a normal image, what would this be called? You want to the definition of hallucination, right? Very good definition given by Yasser. Fine, yeah, go ahead. You also mentioned no object for complete hallucinations. So the criteria of the hallucination. First, at the outset, it tells that the activity has to be clear, which directly contradicts with the object. These are of instinctual signals actually. So when you go everything is not psychic. So sometimes they have been called as so they don't that our actually not any typical hallucinations, but almost similar to this. Between the down, according to the definition of read about the forward transformation and one error. One error.
कौन से कॉमन होते हैं कॉम्प्लिकेटेड have any of you ever experienced usually yeah, even when the patient has like what's the right answer, even when the patient says that I was going to sleep, it is usually that he has got up, he does not remember, and when he is going to sleep, then he has hallucinations. So cognitive, like while going to sleep, cognitive, then we are waking up. And they are very terrifying. Patients also and on seeing this other disorder also, apnea also, some people they have that somebody stands that is very common because they're choking or they have that apnea kind of thing and somebody is choking them. That is a very
often actually conjugated this thing that you told is often conjugated sleep paralysis.
yes.
Sleep paralysis happens, and this is the expression they do think, and they think that somebody is sitting on them, just choking them,
yes.
maybe a devilish figure or something like that. It's very common in the village. So they explain sleep paralysis in that way. One of our patients came now looking is explaining this thing. He was almost going to let's stand psychosis. Then Ravi sir came and he had actually seen the patient. So he very common. So if you ask people with like mostly an audience, they're one or two will get it's like that. Very like I'm seeing recently that person because at that time person is also having disturbed sleep. So it can occur. Many of the religious experiences that you have, like, it could be deep in it. So suddenly you can see you can experience people in trance state, yogic state, they often experience this.
So they're able to see what is happening somewhere else. So neurologically, you can explain those experiences on these basis. So what I would say your comments were.
For her, she has read it now. You guys also what for her. So you understand practice because these are the things we'll be able in office, you will not get that opportunity. And that is how you learn. I think
it's good presentation. I think you like usually while giving this presentation, the time what happens is you get fatigued, you read down. So your presentation was in the last slide also presented very well, and I think that you can share this slide with your colleagues. So it is for
revision also very good.
Yes, for revision exam. So if you made a word file, it is okay. Otherwise, you can share this PPT. So your colleagues will also make some others will you have by the end of the 3 years will have to consider notes. Okay. So this you will find in the textbooks. But what you should try to do is that not stop at hallucination or perception. Go into a little bit of depth. That will help you in clarifying the number of diagnoses. I think one of the patients that we recently saw, and he had such fantastic delusions that he was being, like considering the schizophrenia as a diagnosis. But if you analyze all the delusions, hallucinations, so you will find that they are these kind of clear hallucinations or fantastic hallucinations are more found in organic cells. Okay, and auditory hallucinations, yes, are more common. If you find visual hallucinations, tactile hallucinations, then you should always consider, say, aggressively consider some organic pathology also. Right? You that some delusions can form secondary to hallucinations. Okay, secondary delusions. So you should clarify. Always, if you have delusions, you should clarify. Like paranoid delusions. Person says that my neighbors are wanting to kill me. So he has a delusion. So you ask him how. He says, I hear voices. They are basically secondary to the hallucination. Okay, so similarly, the bugs is having some delusional interpretations. So you can have a quickly forming, because hallucinations have delusions take time, hallucinations have a property, so they can progress very well systematized delusional system secondary to hallucinations. Okay, with different kind of people, different people plotting. So, okay, so don't misinterpret one finding only for a number of times. So yes, that is all. इसके बाद में और कौन सा नेक्स्ट सीरीज में कोड क्या है प्रोसेस के बाद और कौन कर रहा है वो ठीक है. So you have a clue how she is done. Okay, so you prepare that. ठीक है. Okay. इसमें एक बस चीज मिसिंग है, Jasper's criteria, which I think should be is important, most important, because they are not given clearly in the text, but you'll find some articles. ठीक है. कितने पेशेंट around how to give you starting time.
अच्छा तो ये भेज देना आज पढ़ूंगी मैं बैठ उससे पूछना ना फ्रेंच और वो जर्मन जो बून समथिंग नाम है जैस्पर नहीं मैंने जैस्पर नहीं सुना है सर. सब तो जैस्पर तो फिर होजे हो जाएगा ना, फिर वो जैसे जे के ऊपर जैसे वो होता है, लेकिन जैस्पर में लिखता नहीं कोई भी नाम नहीं है फ्रेंच में जो सुना होता है सर. मुझे ना आजकल सपने बहुत ज्यादा बुरे आ रहे हैं. Do you think there's something wrong? बहुत ही अजीब सपने आ रहे हैं.
सबके आपका तो पहला एक ही केस
बसों का फिर ये लोग जब ऊपर आ जाएंगे नीचे. अच्छा
सर अभी सर उनसे पूछेंगे कि भाई ये किसके साथ है, मुझे क्या
फर्स्ट टाइम सिम्टम्स बोलना कि वो कह रही है मुझे मार रहा है, ये वो तो सोमैटिक पैसिविटी, खांसी करा रहा है, मेड एक्टिव और कुछ ब्रॉडकास्ट कमेंट्री रनिंग कमेंट्री। वो क्या नाम आईसीडी के क्राइटेरिया
हो सकता है।
ये मैम कहते हैं सर ने छुट्टी क्यों लिया? मीटिंग बंद नहीं हो रही है? तो अपलोड कर रही है आजकल है ना, सब चेक कर लेंगे ना किसी दिन, तो फिर बुरा हो जाएगा हमारे साथ। सोचा है कि मैं रात को सुबह वाले से बैठ के कोर्स करता
यार ये बंद क्यों नहीं हो रही है? हेलो, हाँ जी मैम। हाँ वो शानी आ रही है, एक उसका पहला पेशेंट है।